Welcome all to our first Research Ethics Conference. Thank you for being here today. This year's topic is, Research with Children in Areas of Conflict. We'll begin our day by Layla, telling her story in her own way.
Hello everyone, this is me, Layla. I am 8 years old. I am from Syria. I will tell you my story. This was my happy family. Mom, Dad, and my little brother Sammy. We lived in a beautiful house. I liked sitting under the nearby tree and watching the birds dance in the sky. Sammy and I loved going to our school together every day. My favorite subject was art. One day, I was peacefully sleeping in my comfy bed when I heard a loud bang. Boom! All of a sudden, our house was destroyed and there was fire everywhere. My mom and dad stopped moving. I called them multiple times. They didn't answer. They were dead. I was bleeding. My pink dress was all blood. I could not find Sammy. When going to the hospital, I could hear explosions on the road non-stop. There, I woke up all alone. I was so scared. I was crying. A doctor came to talk to me. He said that the other doctor is seeing other patients and will come to take care of my wounds once she finishes. He then told me he needs my consent to participate in a research study involving a new vaccine. I didn't understand. He then asked me to say yes or no. I hate needles, but I was too afraid to say no. I said yes, whatever you want. He said I should sign a paper. When I told him I don't know what that means, he told me to just write my name. Then, he gave me the vaccine. After that, another doctor came and treated my wounds. She was nice, but she didn't speak to me. She didn't know my language. I was not in pain now. My uncle came and I can leave the hospital. I left as fast as I can. All I wanted was to go search for Sammy. However, a big man with a gun stopped us. He said that he knows that I am now cooperating with foreigners and betraying my country. What? I only did what the doctors said. I did nothing wrong. He didn't listen. He took us to a nearby military camp and said he will kill us. None of this would have happened if I didn't talk with the evil doctors.
What happened with Layla is horrible. None of this should have happened to her. Many research ethical principles were violated. First issue is whether time and resources should be used for research instead of treating the injured. In Layla's case, rather than trying to enroll her in the project, the doctor must have started the treatment immediately. Second, the issue of informed consent. In conflict settings, obtaining parental consent can be difficult. For example, in Layla's situation, both of her parents are dead. However, that doesn't permit the researcher to consent the child. Layla's uncle could have substituted her parents. Third, researchers should use language and terminology that the child can comprehend. Layla clearly didn't understand anything about the research procedures, harm or potential benefits. Fourth, feasibility question arises. Starting research in a conflict zone that would not be completed is unethical, especially that it could waste much needed resources. The researchers clearly won't be able to follow up with Layla to check for potential protection against the disease or even side effects. Lastly, In a very sensitive setting like a conflict area, researchers must be aware of the implications participating in a study will cause to children and their families. Layla's participation was considered dealing with traitors and caused her to be an imminent menace. Thank you all for being here today. And special thanks to Layla for her courage to share her story. I hope now you are aware of the ethical issues that might arise when doing research with children in conflict settings and will always work for the best interest of these children.